Have you ever been in the hospital and felt the love and compassion from the healthcare providers in your visit? The compassion shown by these people is so important when it comes to choosing healthcare as your profession, but sometimes the compassion becomes overwhelming and develops into compassion fatigue. Hello everyone, I'm Kelsey Gray, and after 4 years of being in healthcare, I have seen and experienced compassion fatigue firsthand. It is so disheartening to see others who used to have the most compassion develop compassion fatigue and become numb to feelings. Compassion fatigue makes it harder for healthcare providers to perform patient care due to the loss of empathy, therefore causing negative patient outcomes and decline of mental health in the providers. Healthcare professionals devote their time and heart into their work. So let's discuss this topic on a deeper level, and maybe you can support the fellow healthcare providers in your life. I'll explain compassion fatigue, what it is, its effect on patient care, and its effect on the healthcare professional's personal life. Compassion fatigue affects healthcare professionals everywhere. Compassion is a fundamental emotion that helps healthcare providers connect better with their patients and understand their patients better. Healthcare providers develop compassion fatigue due to overwhelming stress placed on their work life. In Mama Elvie's 2023 article for the Journal of Education and Research in Nursing called Compassion Fatigue, Empathy, and Emotional Contagion in Nursing Students, he writes, compassion fatigue is known as psychosocial exhaustion and causes a decrease in work-related skills and energy due to the trauma that causes as a result of caregivers' willingness to approach and care for individuals in their need of care with empathy. Healthcare providers take pride in their compassion for others. This characteristic helps to better care for their patients, but this compassion skills decrease significantly when they develop compassion fatigue. Healthcare workers everywhere have recently struggled with a decline in compassion due to stress overload during the pandemic. Since discussing what compassion fatigue is, let's discuss the effects of compassion fatigue on our patients. When experiencing compassion fatigue, the will to care for others declines, becoming a major problem for our patients. And in 2020, Debbie L. Stone wrote in an article called Moving from Compassion Fatigue to Compassion Resilience, Part 4, Signs and Consequences of Compassion Fatigue. From the Hospital National Library of Medicine's website, she says, as the ability to effectively sympathize, empathize, and engage with care declines, the quality of patient and clients that is provided will also decline, leading to less than optimal care and outcomes. The ability to empathize and sympathize with our patients decline, causing them to feel disconnected from us, from their caregivers, therefore causing them to feel like their health isn't a priority of the caregiver. Finally, let's examine how compassion fatigue impacts the personal lives of healthcare professionals. In 2024, Jess Baker and Vincent Rod wrote an online journal article in the British Journal of Community Nursing called Compassion Fatigue in Community Nursing, What It Is, Who is Susceptible, and What Can Be Done. They write, compassion fatigue drags people away from effective caring in one of two directions. Some become toughened. They withdraw from the pain they witness. They become numb. They lose their empathy. Others head in the opposite direction. They become unable to differentiate their own pain from that of their own pain of their patients. They lose themselves. Oftentimes, when compassion fatigue takes place, healthcare providers begin to question their ability to care for others. They wonder if they're even good enough. In Tracy O. Boggs' 2024 journal article from Galileo called Identifying and Addressing Compassion Fatigue to Improve Well-Being, she writes that compassion fatigue can cause these things: anxiety, decreased job satisfaction, disempowerment, fatigue, the feeling of confusion, headaches, hopelessness, impulsiveness, irritability, negativity, and weight change. These negative effects are detrimental to the healthcare professionals' mental health and causes tremendous negative outcomes in not only their work life but their personal lives. Finally, now you know the detrimental effects of compassion fatigue and how it can be so harmful to healthcare professionals and their patients. After seeing the negative impacts of compassion fatigue on myself and my fellow co-workers, I made the decision to kick compassion fatigue in the butt and help myself and others gain their compassion back. My compassion is now the strongest it has ever been. We know that compassion is fundamental in healthcare. The stress that causes compassion fatigue is overwhelming. We now see that compassion fatigue negatively impacts patient care and healthcare professionals' personal lives. I have explained what compassion fatigue is, how it affects our patients, and the negative impact it has on our healthcare professionals' personal lives. You can impact your fellow healthcare professionals around you to make them feel loved and supported for their hard work. Let's take healthcare workers off the back burner and give them the credit they deserve. Thank you.